My name is Augustus Silver Walker Jr., Director, Communication and Health Promotion Unit.
Good morning and welcome to
Press
NTV.
briefing.
This is a major press briefing between the
NPHIL, National Public Health
NPHIL and the Ministry of Health on the prevention of MPOX outbreak in Liberia. Following, we are right here live from the conference hall of the Ministry of Health,
General for NPHIL, Dr. Sia Kamalu. And we also have Deputy Minister Malaya Chiru, Minister of Planning, MAE, Policy. We also have Assistant Minister for Preventive Services, Dr. Jabel Howard. We have the Program Manager at the Expanded Program on Immunization, EPI, Dr. Yua. We have Dr. Keinen from the NPHIL 2 as well, Technical Services, yes. And we have Mr. Walter Gorigari Jr., also here the board for NPHIL. We have Mr. Mark Nagwe Nelson, serving as the third lead for the RCCE Incident Management System. So basically, we're here today to give the update on the MPOX status across the country. So I now turn the floor over to the high table.
This is a press statement on the MPOX situation in Nigeria. Distinguished guests, members of the Fourth Estate, ladies and gentlemen, I bring you greetings from the Ministry of Health, the National Public Health Institute, and all of our partners. Let me first begin by extending special thanks to His Excellency Joseph Nima Walker, President of the Republic of Liberia, and the Government of Liberia for supporting the Ministry of Health and the National Public Health Institute in this MPOX response. We also want to give thanks to all our partner agencies for their technical and financial support from the start of Liberia's MPOX epidemic, which was in September 2024, up to this point. The purpose of this press conference is to provide an update on the status of the MPOX situation in Liberia, to enable the public to better understand and support the efforts of the government in ending the outbreak. As of the most recent reporting period, which was November 3rd, 2025, from our state rep, number 87, Liberia has recorded a total of 2,447 suspected cases of MPOX, reflecting ongoing transmission across the 15 counties, affecting 65 out of 98 health districts. Of those suspected cases, 2,309 samples have been tested at the National Reference Lab, and 1,308 cases have been laboratory confirmed, reflecting a cumulative positivity rate of 56.6%, which indicates significant ongoing community transmission. The Ministry of Health and the National Public Health Institute, in collaboration with relevant partners, continues to implement enhanced surveillance, laboratory testing, and case management measures to control the spread of the infection. Currently, there are 148 active MPOX cases undergoing monitoring and clinical care in designated infectious disease hospitals, treatment, isolation facilities, and home-based care settings. Of these, Monserrado accounts for 57% of those cases, and it affects Bushward, Commonwealth District, Central Monrovia, and Somalia District. In Nimba, the cases account for 18%, and the districts affected in Nimba are Sanipoleman, Bangor, and Zoge. The cases in Magibi accounts for 7% of our total case, affecting Firestone and Kakata districts. In Grand Bassa, 5% of our cases are reported from there, and there are two districts that are mainly affected in Grand Bassa. They are Buchanan and District number 4. 4% of our cases come from Grand Cru, and it affects Trent, Barclayville, and Joie districts. The rest of the counties report about 2% or below of those cases. Recovery efforts have largely been successful, with 1,154 patients reported to have recovered fully following treatment and clinical follow-ups. To date, the country has reported 6 MPOX deaths, resulting in a case fatality rate of 0.5%. This relative low case fatality rate reflects ongoing efforts by the Ministry of Health and the National Public Health Institute and its partners to strengthen surveillance, case management, and public awareness interventions. There is continual emergence of new suspected cases, and this underscores the need for sustained vigilance, community engagement, and adequate resource mobilization to effectively control and prevent further spread of the disease within Liberia. Ladies and gentlemen, members of the press, the Ministry of Health, the National Public Health Institute, and our partners agencies are collaborating in the response and have resolved to embark on the following efforts to curb transmission of the MPOX virus within the next 60 to 90 days. These are the following actions that will be taken over this period. There will be intensification of active case finding, and we will place all confirmed cases into treatment. We will manage cases in a timely manner, both at the facility and home-based care. We will augment services at the Liberia Center for Infectious Disease Hospital through provision of essential medical supplies, diagnostics, and equipment to the Infectious Disease Hospital, other isolation centers. We will conduct core competency refresher training on MPOX for our frontline clinicians. This will be supported by simplified tools and drug aids. There will be a robust risk communication and community engagement. We will empower community leaders, market leaders, and youth networks to drive early reporting and safe behavior. Hand washing will be encouraged in all the communities. There will be increased awareness of the sexual transmission of this disease. We also intend to launch preventive ring vaccination in Monserrado and other hotspots in other counties where there are high cases, and we will observe the transmission trend thereafter. The Ministry of Health and the National Public Health Institute will start awareness and sensitization of the MPOX vaccination campaign beginning this November, but the actual vaccination will commence in the first week of December, and this will continue up to January next year, mainly targeting individuals 18 years and above across the country. Recently, we received additional 42,720 doses of MPOX vaccine, which was donated to the government of Liberia through a consortium comprising of the US CDC, Africa CDC, the Global Alliance for Vaccine and Immunization, UNICEF, and the Coalition for Epidemic Preparedness Innovations. We had previously a donation of 10,800 doses of the vaccine, and this will augment that donation. There will be daily incident management calls to timely address emerging issues, secure logistics, fuel, cold chain, and hotspot dashboards for precise resource deployment. There will be weekly infection prevention and control audits to maintain zero health workers exposure, and there will be supportive supervision. Our goal between now, November 2025, and January 2026 is to detect and investigate more than 90% of the suspected cases within 24 to 48 hours nationwide, and ensure 100% of collected samples are tested with results available within 48 hours. We also wish to achieve zero preventable MPOX deaths and reduce severe complications through improved intensive care unit capacity, timely diagnostics, refresher training for clinicians, and integrated nutrition and mental health care. We will administer at least 42,720 doses of the MPOX vaccine to high-risk populations in priority districts and counties by the end of January 2026, using a ring approach in hotspots communities. Our risk communication and community engagement, we wish to attain more than 80% awareness on safe practice, early care seeking across the country, particularly in hotspot communities, including Montserrado, Nimba, Magibi, and Grand Bassa, through a targeted risk communication and community engagement intervention. Overall, we wish to reduce the national MPOX cases, sustain and ensure that nationwide positivity rate is low within these 90 days. Ladies and gentlemen, in conclusion, Liberia stands at a critical turning point of sustained MPOX urban transmission. Without bold actions, MPOX transmission will continue to escalate, placing lives, health systems, and communities at risk. We want to encourage and call on all our people, including community leaders, civil society organizations, and other stakeholders, to get fully involved in the MPOX awareness and vaccination campaign. Your support is crucial to the outcome of this MPOX outbreak. Thank you.
That was Dr. Cooper. She just gave
Now we will
the
entertain
important budget on
from
how
the
to
press, and those
take
questions
precaution
will
for
be answered
the
by members
MPOX
of this
outbreak.
team.
And the official launch of the campaign is in this month, November. And she also emphasized on the vaccine that will be coming in December. So keep following LMTV as we bring you this update.
So thank you very much. I'm Yakia Paita, and I report for the Heritage newspaper. One lesson from previous outbreak like Ebola, COVID-19 have been empowered to the monkeypox, response, and preparedness. awareness.
So we take a few questions and then we can answer.
So, good afternoon to the high table. My name is Emmanuel Chief. I'm reporting for Cool FM. I heard you talked about what you'll be engaging in a couple of days in terms of reporting back to the library people. Where you talking about 48-hour times you'll be able to investigate 90% of what is happening in the border of the public. So my question is, what is the current capacity of the NPHIL and the collaboration with the Ministry of Health to ensure that 90% of these cases or the cause of these cases are investigated in the border of the people? And another thing, and help people, you will help experts are telling people one of the surest ways we can deal with combat this virus is to wear those masks. Fortunately, on the table, we are seeing nobody wear those masks. What do you comment?
Thank you very much. My name is Emmanuel from the New Ghana. Thanks to the LP for the fight was the you I see you are doing progress. You talked about 1,000 recovery. I'm more concerned about the relapse of this patient. Are they home, or what are you doing to ensure that they don't suffer relapse?
No more question.
So we'll answer the questions as a team.
So if you just joining us, we are here in the conference hall of the Ministry of Health, and this joint conference is between the NPHIL and the Ministry of Health on the prevention of MPOX disease that is currently in Liberia.
So what lessons, against monkeypox, the COVID question is the one I want to answer. What lessons have we learned from past outbreaks in terms of the Ebola virus and COVID, and what are we applying? Liberia went through a very tough time with Ebola, and we learned some painful lessons, but the strategies that were deployed in terms of risk communication, community engagement, social mobilization. We realized when we went to the people, the participation of the community made a great impact because our facilities were overwhelmed. We couldn't keep everybody in facilities, and we realized it was the communities that were now quarantining, that were now reporting cases. So when the community, when everybody joins together, like I said the other day, when we have a coup, when you come on the farm and everybody rush together, the work is done faster. So at the community level, make use of the community leaders, the community health workers. That was one strategy that worked well for Liberia, and we are applying it now. I will open it up for anyone else. So, anyone want to comment about?
So to add to that, we learned the lesson of coordination from our previous responses. During the Ebola response, one of the structures that was established was the incident management system, not only at the national level, but also at the counties. And that is sustained even during this outbreak. Right now, the coordination is done at the county level, and there is a national incident management system in place which coordinates all the outbreak response and ensures that all challenges are addressed as quickly as possible. It's used to mobilize resources as well as creates a forum for all our partners to be of support to the outbreak. So those are some of the things that we have learned from previous outbreaks that we are applying now to this MPOX outbreak. So the second question, Dr. Kelena will give a response.
Thank you, Madam People. Thanks to the DG for the opportunity to respond to this second question. It has to do with what capacity exists to be able to report in a timely manner as we investigate these diseases. Right? Now, I just want to firstly build on what Dr. Cooper initially mentioned with respect to coordination. We build significant capacity across the country with respect to responding to public health emergencies. And that is why, as Dr. Cooper indicated, we've been able to establish an incident management system at the national level. And that same structure is cascaded down to the county level, wherein we have several pillars, including one for coordination. But with respect to the question, I want to focus on the pillars that are responsible for detection, diagnosis, and reporting. So, with respect to our current capacity as a health sector, I would say that we have built significant capacity across the country from the community level, to the district level, to the county up to the national level when it comes to case detection, that is the surveillance infrastructure across the country. We operate within a performance metrics, that is the 717, which allows us up to 7 days to detect public health emergencies wherever they occur across the country, 1 day to report, and then 7 days to mount a comprehensive response to that emergency. So far, we've been able to demonstrate positive results with the MPOX situation within the 717 framework. But notwithstanding, there are inherent challenges within our system for which we've seen increased cases being reported in recent time. As part of the new strategy, we're looking at ways in which we can work much more closely with the community infrastructure, working with the religious leaders, the youth leaders, the women groups, those at the community level, to be able to support our surveillance system to detect these cases in a timely manner. We saw that in Ebola, we saw that in COVID-19, that where the communities were involved, we were able to bend the curve and continue the outbreak as soon as possible. So as these cases are detected at the community level, we have built our diagnostic infrastructure in such a way that we have diagnostic officers as low as at the district level. And these persons are responsible to collect specimens and transport them to the National Reference Laboratory for testing. We know that when it comes to testing the public health emergency, having one diagnostic infrastructure like the National Reference Lab has been a challenge. That is one lesson that we cover in this outbreak. To ensure that we work towards also decentralizing our diagnostic infrastructure, build some diagnostic capacity for MPOX testing at the lab in Maryland, at St. James, and in Bond County. So what that, I mean Norfolk, in Norfolk County. So what that allows us is to help to reduce the turnaround time, because the time from reporting to diagnosing, or from detecting to diagnosing is very important in responding to public health emergencies. So we've been able to also work closely within the time frame of 24 to 48 hours, and that is also the performance metrics that we follow for the diagnostic side for MPOX. And at least up to this point, where we have specimen being collected and transported through the chain of the National Reference Lab. Once it's received at the National Reference Lab, we've been able to provide results in a timely manner, that is within 24 to 48 hours, to ensure that it informs our clinician on the best course of action, and our surveillance team also to isolate these cases where possible to alleviate isolation. Thank you.
I just want to add, in summary, capacity has been built in terms of human capacity. So we have trained district surveillance officers in each of the districts, in each of the counties. We also have point of entry. So our ports, our borders, our airports, we have trained people there to also do surveillance. And we also have a newly established Liberia Center of Infectious Disease, where it has a capacity of about 100 beds, and that's where cases are being managed successfully. And we're also expanding into other counties to set up other treatment units with the help of the partners. Thank you.
So the question was why we are not wearing masks at this table. The use of the mask is to prevent airborne transmission. MPOX is not transmitted through an airborne transmission. It's a contact disease. It's transmitted through contacts. So we are wearing masks within the ministry because there is an influenza virus outbreak. A lot of people are coming down with the cold and cough, and that's an influenza virus outbreak. So that's why we wear the mask, not because of MPOX. I just wanted to be clear that MPOX is transmitted by contacts on the body. They can transmit it through secretions from that lesion on the body. And of course, it is also transmitted sexually because of the lesions in the sexual parts of your body. So on recovery, we have seen, so we are not facing an issue where an MPOX case will relapse. That is not the situation here. We have seen very good recovery. For the number of patients positive, we have only had 6 deaths. And those deaths were because the patient had underlying conditions that coexisted with the MPOX virus. And so the case became very critical. Thank you. Are there any other questions?
Thank you so much.
No, we have.
So
we want to present our state rep before we end.
So these are the officials from the Ministry of Health who have just updated us on the MPOX virus, and they have told the Liberian people how to prevent this virus. But now the result is based on the water show the public on the update of the cases from January 2024 to November 6, 2025. The total suspected, they received by lab, total tested cases, total lab confirmed cases are all displayed up there. And we can see on the board
68% of confirmed cases, followed by Lima County, Rivers of Mikey. So the bread of MPOX is in Mosogalo County.
Further additional information. So on behalf of the Ministry of Health and the National Public Health Institute, we wish to thank the media for coming to our call for this press conference. We appreciate the partnership with you, and we look forward to this information being disseminated to the public so that the public will understand what the situation is, and that as we come out to the public, they will collaborate with us and partner with us so that we can end this outbreak.
for females that are infected with this virus are 520 females, and in Mosurado they have 916 cases in Mosurado County, and in Nimba County is 114, Queen Bassa 45, Margibi 44, Queen Kidman County is 41 cases, and 32 in Bon County. We have Sano is 17, Quencool is 15, and so on. So welcome again to NNTV as we come down with this broadcast. This is an official update on the prevention of the monkeypox outbreak in Liberia. That's between the Ministry of Health and the National Public Health Institute of Liberia. And the conference was held right here in the conference hall of the Ministry of Health. And thank you for following this broadcast. We come down at the end of this